The topic of this video is, are you at risk for low back pain? It has been estimated that 8 out of 10 people will experience low back pain at some point in their lifetime. So it's important to be proactive and do all we can to prevent low back pain. Based on studies and clinical experience, there are common impairments found in those with low back pain that may have predisposed them to injury. I will go over 3 simple tests that you can do at home that can tell you if you're at risk for developing or increasing your low back pain. The first test is called side-lying hip abduction. You will start by lying on your side with both legs straight out and in good alignment. Make sure your legs are in a straight line with your upper body. Lift the leg straight up in the air, hold slowly for 1 second, and lower back down. If you notice any of the following, then you have failed this test. So 1, if your pelvis rolls forward or backwards as you raise your leg, this indicates poor low back stability. 2, if your leg tends to go forward and not stay in line with your upper body, this indicates weakness in your posterior hip muscles. Lastly, if you can't even lift the leg up, or if it's significantly difficult for you, this indicates significant weakness in your core. The second test is called prone hip extension. You will start by lying on your stomach with both legs straight out and arms by your side. You will slowly lift one leg up a few inches towards the ceiling, hold for 1 second, and slowly lower back down. If you notice any of the following, then you have failed this test. 1, your pelvis rotates side to side. Okay? Again, this indicates poor low back stability. 2, as you lift up the leg, the opposite shoulder comes off the table. This indicates significant weakness in your low back. And lastly, if you can't lift the leg up at all, or again, if it's significantly difficult for you, it indicates significant weakness or tightness in your hips. The third and final test is called back to the wall. You will start by standing with your back against the wall with your feet approximately 3 inches from the wall. Slowly try to flatten your lower back against the wall. Now, if you are unable to do 3 things, you fail this test. So 1, if you're unable to flatten your back at all, then obviously you fail that test. 2, if you can bring your back to the wall but your hips have to go off the wall to do so, then you fail this test. And the last common thing that people do is if you try to flatten your back and your upper back comes off the wall to do so. If you have found any of these tests difficult, especially if you failed all 3, you may be at a significant risk for developing low back pain. If you already have low back pain, you may be at risk for chronic symptoms and disability. If any of these tests are difficult for you, or if you're experiencing low back pain, I recommend that you call us for a free consultation to discuss this further with one of our physical therapists. Please go to our website shown below for our contact information. A physical therapist can perform a thorough evaluation and assist you in developing a personalized program to decrease your back pain or prevent you from getting low back pain.